Wow, yes. A lot of listeners sent us this story. There was a press conference last week. Dr. Erickson and his partner at Accelerated Urgent Care in Bakersfield. It turned into a massive hit on YouTube, and it is arguments against the huge economic shutdown in California.
Yeah, he and his partner is Dr. Artin Massihi, and we are going to put Dr. Dan Erickson on the line here. How are you, Doctor?
Doing well, thank you.
All right, now you've and your partner have caused a lot of controversy and gotten a lot of media coverage and got shut down by YouTube. There's a lot to go through here, but for a lot in our audience, a lot of people probably haven't heard of you and don't know what your argument is, what your presentation is about. So if you can boil it down so that the average person can understand what you're saying here.
Well, I've pivoted down to a very simple discussion about herd immunity. I figured it was important to me to reference people who do this for a living. So I've really studied and listened to and interviewed some experts. For instance, the chief epidemiologist of the country of Sweden, Dr. Let me say his name right, Giesecke is his name. I've been listening to his lectures, Dr. Anders Tegnell and Dr. Witkowski. These are people that do this for a living. They analyze epidemiology and they put out statistics and they watch these epidemics for the last 3 decades. And my question to them was, how do we handle this? Sweden, my argument, I guess, is that Sweden is not on lockdown. Kids under the age of 16 are at school. Stores are open. People are doing a little bit of social distancing, and they're doing well. When their infectious disease epidemiologist, Dr. Anders Tegnell, was asked, would you do anything different? He said, we would have done a little bit better job of protecting our elderly. Otherwise, we're very happy with our results. They don't have a crushed economy. They don't have anxiety. They don't have depression. They don't have alcoholism on the rise. And the people are doing well. And they're touting their own freedom, saying, we're the free people now. So my question is, if we're going to lock down our society, I think we need good data. And Dr. Witkowski, who's a doctor in science of medical biometry, has his master's in biostatistics, I interviewed him twice, and he said there is little to no data to support sheltering in place or social distancing. So we look to countries like Sweden who are not doing this and who are open and doing well, and thinking to ourselves, is there something we can learn from them? Can we take Sweden's lead and start opening up our country, specifically the schools, to allow herd immunity to take place?
What would it look like if we did it here? How much more open would things be?
Well, Dr. Giesecke recommended a stepwise approach because we haven't been down this road before. We've never closed our economy. So I would think it's prudent that if you're going to close your economy, you have a plan to close it and then a plan to open it. But I'm seeing kind of some arbitrary things going on where I can walk to Costco and shop with 200 of my friends, and I can go to Del Taco and have people wrap my burrito. But if I try and go to the little restaurant next door, it's closed. And I can go to Home Depot and hang out with 200 people in an aisle with no masks, but I can't go to church. So there's all these arbitrary shutdowns that most people look at it and go, this makes no sense. How come we can't spread out in church? How come we can't, for instance, Sweden allows gatherings under 50, no problem. And we're not allowing any of that. And we're keeping people isolated. And I say, if we're going to do that, let's look at the science of doing that. Riverside just closed down till June. Can you please show us the science of how social distancing and isolation indeed works? If it's out there, I'd love to read it, as would a lot of people. But all we're being told is just do it.
Well, I think a complete shutdown, which is kind of what we're experiencing in California, I think it is effective in stopping the rate of infection, but I think the cost of it is far too great. I think what you described in Sweden is a nice compromise position in order to allow some movement and some economy to continue going, but also making sure that the virus doesn't run out of control. I feel like we just rushed into this in the U.S. after we got bad information out of China from the World Health Organization and Chinese officials.
And panicky modeling.
And then when we realized, all right, it's here, it's in the U.S., and it's probably a lot more cases than we think, they just dove right into this shutdown. I mean, particularly here in California. They've completely overreacted to the point they're driving people off of beaches.
When you shut down an economy and you isolate in place, you flatten the curve. When you flatten the curve, you lengthen the disease cycle, and a secondary spike will come from sheltering in place and social isolation. The epidemiologists are saying, that once you socially isolate, then you have to open slowly with schools and then businesses. But as in Sweden, if we just would have not done that, the epidemiologists are saying this is like a severe flu. It does not have significant differences from the epidemiologist report. We've got about 60-some thousand deaths, which is typical for a bad flu. This is all their data. I'm now pivoting to only their data, as I'm not an expert. I am not an epidemiologist. I am not a virologist. So I'm listening to those who for 30 years have analyzed pandemic cycles and said there is no significant difference to what we're experiencing now.
What was I'm sorry, go ahead.
Well, when Dr. Wiskowski was asked why the response globally to this, and he said a lot of it has to do with communication and the internet and people's ability to spread panic and fear. In China, the pandemic is over. In South Korea, the pandemic is over. And people say, well, you can't trust the data. Well, it's very difficult to keep these things under the hood. And South Korea, its spike went up and down. The pandemic is basically over. And we're flattened out. But since we socially isolated, we dragged out this disease process.
All right, can you hang on and talk to us a little bit longer?
Sure.
All right, this is Dr. Dan Erickson, along with his partner.
And he's been doing a lot of media interviews, gotten a lot of attention.
Yeah, it started with a news conference last week, and then it went to a YouTube video, and he's been doing interviews, and it does question the need for this total shutdown that is going on over COVID-19.
What was on your video that caused YouTube to withdraw it? I don't understand that angle of the story.
I didn't get an official statement from YouTube, but if I had to say something to YouTube, I'd say they're doing incredibly well right now, but a lot of Americans are not. So my thing would be, instead of worrying about, free speech and taking away our First Amendment, why don't we work together to get Americans back to work? Why don't we make some good solutions and look at the science that allows people to get back to work?
But what you told us in the first segment, you talked a lot about your interviews and the information you've got from Sweden, how they're trying a herd immunity approach. And, that information has been out there in many media sources.
Well,
there was nothing controversial about it.
We can address what this is. Dr. Erickson, apparently you were talking about all the COVID-19 tests that you have done at your clinic, and you were going off of some of that to come up with projections of how many people might have COVID-19 in the population, death rates and such. And I guess what the blowback was is that using the test results from your one clinic is not scientifically, statistically proper. I think that's what the big objection was. Yeah,
and we're getting our data analyzed right now by a biostatistician who can give us the official results. I'll just tell you the background. The media out here had called me and said, do you mind being transparent with your data? Can you show us how many tests you've done, how many positive? I said, sure. And we all met in our conference room, and I started saying, okay, we have 5,200 positives. Actually, I have the exact data right here. I said I have 5,213 positives and 340 positives out of a total of 5,213 cases, which is 6.5%. That's just, they asked me what my numbers were because the community was like, well, you're doing most of the testing. What are your results? So I gave it to them, and I said, California had at that time 280,900 total tested with 33,865 positives, which was 12%. So I said, these are just raw numbers about what we're finding. And they haven't been analyzed by a biostatistician. I'm not an epidemiologist. So that we were doing an interview that I thought would get, we would review the data and then post it, but it was live apparently. And now we're going back through and saying, okay, if we have a biostatistician evaluate this, this is too early to make predictions. We were giving raw data to show where California was at with the raw data. We weren't saying this is the end-all be-all data. And now we need to go back through, as we've had more time to gather data and have it analyzed by a professional who can give us some predictive outcomes.
All right. Well, I think the problem was, the mainstream media crowd and their cohorts in the medical world decided that you were dangerous, particularly since your YouTube video had a couple of million views, and they didn't like you espousing any objections to the stay-at-home orders. I think that's why this blew up on you.
That's probably true. And I've asked people to consider this. I said, we have to consider the collateral damage. I think of it as a scale. On one hand, I have collateral damage, and in one hand, I have viral illness. I'm a physician. I took a Hippocratic oath, and it's super important to me that we do the best thing for the American people. And when I have patients calling me asking for, anti-anxiety medications, telling me they're struggling with alcoholism, they've been living alone for weeks, I hear all these collateral damage of COVID, and I'm balancing against the COVID cases I'm seeing coming in. And in my view, in Kern County, the collateral damage is outweighing the actual damage that the disease is causing in Kern County.
Yeah. That's similar to what Dr. Winters from Santa Monica was on our show yesterday said.
And some ER doctors are saying that people are not showing up and they may have serious problems.
Unfortunately, all the suffering is going on behind closed doors. We have Gavin Newsom on the one end scaring people into their homes. On the other end are millions of people who are very, very emotionally upset. And they're very scared, especially if they're running out of money or their business is in danger of going out of business. I mean, it's terrible, and they're not being heard from, and the media isn't covering it. They're just running the scare stories.
Let me give you another example. I interviewed Dr. David Lang out of Wisconsin. I said, David, you worked an ER shift last night. What happened? He said, well, it's the craziest thing. People are waiting. They have chest pain, and they wait 2, 3, 4 days to come in. Well, they were having an MI, and now they have more significant problems. They were having abdominal pain and didn't come in. He said, I had multiple cases. This is firsthand where they delayed care and had a bad outcome. And then I heard an interview for Dr. Jensen today, state senator of Minnesota, and he said he's being coached to add COVID-19 to the death certificate, even though the patients weren't positive.
And what's the benefit of that?
That is a question for hospitals, and I don't know that they would give you an accurate answer.
Yeah, it's strange because today I'm also reading now they think they may have undercounted the coronavirus deaths because some people aren't tested after they pass away. But you're presenting another side, which is maybe they're overcounting the coronavirus deaths because people are told they need to put that on the death certificate, even though it may not be the final cause.
Do hospitals get more money if it's a coronavirus death?
I'm not a hospital, and I don't want to hypothesize. That's a good. I have asked the hospitals in the area how their census is, and one of them, I talked to 3. They said one's at 40%, and I said, "Do you have surge capacity?" And they said, "Absolutely, we do. We're ready."
There wasn't a single hospital that got anywhere near their capacity.
Not
California.
Where I am. They're asking me, are you as slow as we are? They're going, what happened? And people got scared.
Here's the thing. The criteria for this lockdown was want to flatten the curve and avoid a hospital surge. There's no hospital anywhere close to capacity. There was no surge. And the curve is flattened.
Can you answer me this? What is the logic to flattening the curve?
I don't even know what the logic. Well, the logic was not to have a surge at the hospitals. But we never had the surge at the hospitals.
But they're going to claim that's because we stayed at home.
Okay, but clearly
it's circular.
No, but clearly, if we had an increase in cases, they wouldn't come near capacity.
Sweden didn't stay home and didn't have this overwhelming presence. So you can't necessarily say, well, because we sheltered in place, we didn't have a surge. Well, Sweden didn't shelter in place and they didn't get overwhelmed. So I don't understand the logic of flattening the curve, lengthening the disease cycle, and crushing the economy. I don't understand that.
Because flattening the curve, you're right, lengthens the cycle, which crushes the economy. 1, 2, 3. One leads to the next. The crushing the economy part, nobody signed up for.
Well,
we just want to avoid the surge at the hospitals, which we did.
If you looked at the initial models that Fauci put forth, they were giving us approximately 2 million deaths. their models were pretty far off. And so my question is just, if we're going to make these decisions, let it help us understand the science and help us understand the plan when you're going to lock down an economy, how you're going to get it back up in a stepwise approach. I think that's prudent to tell the Americans.
I don't understand this whole respect the science crowd when you had these models predicting 2 million deaths. I really don't. I don't get it.
Dr. Dan Erickson, we appreciate you coming on and sticking your neck out there with this. This is good stuff to hear from you.
Thank you.
All right, that's Dr. Dan Erickson, Accelerated Urgent Care in Bakersfield. This big YouTube video that he made with his partner where they were answering questions from a local TV station about their COVID-19 tests. And it blew up into this whole big story because Dr. Erickson is simply questioning the stay-at-home orders.
You're not allowed to question anything. Boy. Communism is